Hi, I'm Josephine Windsor Lewis, and today I'm going to teach you how you can save lives with a smartphone. Pretty ambitious, but if you stick with me, I'll walk you through it step by step. My background is in building medical devices and medical device software. In my free time, I'm trying to teach myself cybersecurity. One of the very first things that I learned, and something that you guys are probably more familiar with than I am, is that the first step in finding a solution is understanding the threat. So what's the threat here? What are we saving lives from? Neonatal jaundice. This is a medical term with two main parts: neonatal, meaning affecting infants or newborn babies, and jaundice. Jaundice is a term used to describe a yellowing of the skin and the sclera, that's the whites of the eyes. It's caused by a buildup of bilirubin, which is a yellow-orange bile pigment produced when your body gets rid of red blood cells. Now, usually bilirubin is not a big deal. It's filtered out from your body like any other waste product. It's when this delicate balance is disrupted that issues start to arise. There are a couple of different ways this can happen, but the important thing is that as bilirubin builds up in your bloodstream, it causes abdominal pain, fever, weakness, fatigue, and at really high levels, it can pass through the blood-brain barrier, causing permanent disability or death. This is a massive issue, and it's a global health crisis. Neonatal jaundice affects up to 80% of premature births and up to 60% of full-term births. It can be fatal, and although it's difficult to prevent, it is quite easy to cure if it's diagnosed early enough. In less severe cases, it can be treated with exposure to UV light, which is phototherapy, and oxygen, and in more severe cases, an exchange transfusion can be used. If it can be treated, then why is it still causing 114,000 infant deaths every year? To understand this, we have to look at where those deaths are happening. 3/4 of them occur in sub-Saharan Africa and South Asia. And there's a number of different reasons which contribute to this, including an increased likelihood of certain genetic risk factors, like a G6PD deficiency, and a lack of access to healthcare. But the leading cause is the difficulty of diagnosing jaundice using traditional methods like visual inspection in infants with darker skin tones. It's just much more difficult to detect a yellowing of the skin in infants with a darker skin tone, and that's the current standard practice. The need for a reliable, low-cost screening solution which is accurate regardless of skin tone is clear. So what are our options? In the UK, an infant who is suspected of having neonatal jaundice can be given a blood test to determine the exact levels of bilirubin in their bloodstream. This is the gold standard diagnostic technique, and although it's very accurate, it's simply not a feasible option for many infants in countries where there's difficulty in accessing the expensive and bulky medical equipment that's needed to perform this kind of testing. It is also an invasive procedure which can be really difficult for parents of newborns, as it involves drawing blood. The other methods I've already talked about, looking at the skin tone and the sclera, that's marked on this image, the white of the eye. What we need is a solution that is non-invasive and cost-effective. A method that's being trialled in the UK is colorimetry. That's using these big, expensive pieces of equipment called colorimetry machines. They measure the colour of a surface by looking at the rate of absorption of different wavelengths of light. I got to play with some of these in my second year of university, and I got involved in a project which was looking at recreating this effect using DSLR cameras. You take a picture with the camera, export it to a computer, and then use a program written in MATLAB to do analysis. I was debating back and forward with my professor, and I said, surely this could all be done on a smartphone. And he said, no, that's impossible. So of course I did what anyone else would have done, and I spent the next 3 years of my life proving him wrong. We designed an app, a smartphone app, which would allow us to complete this colorimetry procedure. Luckily, this was possible thanks to the rapid advance in technology over the last few years, not only in the sensitivity of smartphone cameras, but also in the processing power that it requires to perform analysis like this. We created an app that uses 2 images of the whites of the eye to screen for neonatal jaundice. 2 things to focus on here. Firstly, the whites of the eye. That's because this is a pretty consistent colour across infants of all skin tones. And secondly, 2 images. We use a flash and non-flash pair. This is basically done to remove ambient lighting from the equation. When you take an image with flash and then an image with no flash, you can subtract one from the other and are left with a composite image, which only takes into account the light that was emitted from the flash, excluding all ambient lighting, which is important because yellow light makes the image look more yellow and blue light does the same for blue. When we want a really accurate reading of what the actual colour of the eye is, that's really important for an accurate diagnosis. Quick moment to shout out the organisations that supported me in this project. It was a collaborative effort across all of these organisations and these charities who are really, really fantastic in supplying financial support to the organisations that have assisted in the Saving Lives at Birth project. I started this app with a proof of concept that I built over about 2 months in the summer of my second year of university. It was really ambitious. I built a very customizable app, which was designed to be adaptable to the needs of the user. Once I'd proved it, I had to go back to the drawing board. I spoke to these wonderful, wonderful doctors, Dr. Christabel and Dr. Judith, who are both paediatric consultants, Dr. Christabel in Accra Hospital in Ghana and Dr. Judith at the University College London Hospital. We sat down and we talked not only to them but also to midwives and the neonatal care teams, and we asked them what they needed out of this app. This is called user-driven development. Instead of me assuming their needs, I asked them directly. I gave them my prototype and they came back and they had a whole bunch of requests, which was so wonderful. They said, "We love how customizable it is, but that's not what's important to us. We need it to be simple. We're already dealing with a baby, which can be difficult at the best of times. This app needs to be intuitive, not take up too much of our brain space. We need to be focused on the patient here. We also want you to remove all of the sounds you've put in. They're really disruptive." It was tips like this that really helped make the app so much better. In the end, we settled on a design with 4 stages, using the 2 main principles that they had prioritized: intuitive design and minimal use of language. They don't want to have to read lots of stuff, and also this app will hopefully go out to a wider reach where crossing language barriers, and we want to make it accessible. The first stage is just a full screen camera, showing you as much of the image as possible so that you can focus on getting a clear shot of the white of the eye. There is a camera capture button, a little counter to show you how many pairs of images you've taken. And when you've finished taking enough images, we recommend 5 pairs. And then you just press the tick button to show that you're done. Here's what that looks like in real life on a prototype version. The next stage, it shows you the pair of images that you have already captured, one above the other, the flash and the non-flash images, which is a little bit difficult. You can see it better here in this image of the app in use. And because it's very difficult to capture an image that is entirely taken up with the white of the eye, as I said, babies tend to move about quite a bit. You can then zoom in and pan using quite intuitive pinch to zoom and scroll to pan methods. That allows you to get the sample area, that's this little yellow square in the middle of each image, over the area of the eye that is entirely covered by just the sclera, just the white, avoiding any veins or shadows or the eyelid, and making sure you can get a good sample out of the image. This little area is actually all we're going to be looking at in order to determine the colorimetry of that white of the eye. This allows you not only to check that the image quality is good and that you can get a good sample. If you can't, hit that delete button, but it also lets you control the image after you've taken it and focus on getting a good image without worrying about making sure there's no eyelid in it in the initial stages. This is just showing what that looks like. The little area you want to be focusing in on here is the sclera. Once you've done that, then you just press next and we get some results. We average out a couple of different images because this is science, this is diagnostics, and we need the most accurate reading we can. It will show you the SCB, that is your projected bilirubin levels based on the results, what we think that means, and then a confidence rating, because we want the healthcare professionals to feel confident in what the app is telling them. If we think it's on the edge, we'll tell you that and you can monitor the patient carefully. But if we think it's definitely jaundice, then we'll recommend immediate action. After this, since this is a research project, we have the advanced results screen. That means that we can feed back more intense data straight back to the team for continual improvement. Now, this app is based on the Camera 2 API. We decided to do it in Android because it gives us much more control over the camera itself. An API is just a programming interface. It's a bunch of different modules, a framework that allows you to build your own apps. The Camera 2 API is one of the most advanced in terms of the level of control it gives you, but it wasn't advanced enough. We needed to build a custom camera capture session module. Now that's because to understand that, you need to understand the internal workings of a camera. This is a Bayer matrix. It's what the inside of your camera looks like, or it's a scientific approximation, which is nearly as cool. It's a series of light sensors, red, green, and blue, with more green because your eye is the most sensitive to that. And these light sensors come together to form pixels, 4 of them in a pixel. The reason this is important is because you can't access individual light sensors using the Camera 2 API. So we had to build a custom module which would allow us to get data directly from these sensors rather than an averaged out version which compensated already for white balance and other factors. We needed the actual data to get the most accurate reading. We don't care about the image looking good, we just need to understand it from a scientific point of view. This involved getting the raw image data, something that is not standardized across different cameras and not standard across different phone models either, and transforming that into an image file that we could read. To do this, we used a custom raw image to DNG file conversion. This is something that's still under development. Currently, it only works for a few specific brands of phone, but because they have to hard code certain values into the software to compensate for things like different color filter arrangements, orientation, masked pixels, as well as a lot of different other characteristics. Once we've got this into a tagged image file format, TIFF or DNG, then we can move on to sampling. This is a rough understanding of how the app is laid out in terms of the modules used. As you can see, there is a large section dedicated to this raw analysis, that's the green and the blue sections. It's a custom microservices architecture, which is just a fancy way of saying we built the app in a way that is highly maintainable and really testable. It uses a main activity and then hosts different fragments within that to perform the different features of the app. Once we've built the app, we needed to calibrate it. As I mentioned, each camera is going to be slightly different, but also the flash is slightly different on each model of phone. Some are yellower, some are more white, and they vary in brightness as well. So we needed to calibrate to a known color, and these swatches are what we use to do that. We take images of colors where we know the exact color value under a range of different conditions, and then we look at the output we're getting from the app, and we calibrate it against the known color values of these swatches. This is another hold up at the moment because it means the app can't just be deployed, you can't just download it and go. It needs to be calibrated for the specific phone that you're using, and this really needs to be done in a lab conditions. Again, something we're working on, and hopefully in future iterations of this project, this can be avoided and we can find a way to calibrate it remotely for the phone or using an easier procedure because these color swatches are really difficult to get hold of and really difficult to maintain. They're very, very sensitive. Something else to consider is security. Now, as you can probably tell due to this slide coming quite so late in the presentation, security wasn't baked into this project from the beginning. Unfortunately, I'm a developer and the rest of the people working on the project are scientists. We didn't have much experience with security. To give you some background, this app is designed to be used by healthcare workers working in really remote locations who don't have access to reliable internet and may not be able to download the latest firmware updates for their phones, leaving them really vulnerable. In earlier iterations, we were sending really sensitive data completely unencrypted over the internet. This is not ideal. It's not just a theoretical problem. There have been several cases recently where mHealth apps have been targeted by malicious actors because it's a really vulnerable situation you're in when you're dealing with health data. And not just because we want to protect people. This is a medical device and there are legal requirements surrounding medical devices and cybersecurity. In order for the device to pass through these legislatures and be available on the market, we need to come up with a way of making the data secure. Currently, our data transfer solution is just not doing it over the internet. We keep everything completely manual on the phones and keep them offline to try and secure them as best we can. This isn't ideal. Our other solution is to ask for help. If you or someone you know are interested in security and phone applications, or ideally mHealth security, we would absolutely love to hear from you. Please get in touch. My details are going to be available at the end of the presentation. The next stage is field testing, and we're really, really excited. So far, we have 2 field testing locations, one in the UK and one in Accra in Ghana. 504 babies have already been surveyed in Accra General Hospital, so that we can verify these results against that gold standard blood test. The next step is going to be expanding to different locations, getting more people involved in the project, and hopefully saving some lives. If you have any questions, feel free to reach out to me on Twitter, or you can find me on LinkedIn. I look forward to getting more involved in cybersecurity in the future, and I really hope you've enjoyed the presentation today. Thank you so much for listening.